doing it. You supposed to be happy you sitting there with Kid L. Why you mad?
The Kid L Podcast.
Rock and rolling. Dr. Griffin is in the building, man.
What's the deal?
Fresh as hell.
Am I?
Yes.
These old threads?
You're killing it right now, man. You're making me look like I went to the Salvation Army or something.
Hey, man.
Jesus, and I spent $200 on this turtleneck. I did. This is a Hugo Boss, man. This is
Oh, damn.
You see what I'm saying?
Yeah.
Man, we're talking about plastic surgery today.
Yeah.
Talking
Let's talk
about
about it.
the medical field, man. We rarely talk about stuff like this, but I've seen your work.
Have you?
Incredible.
What you think?
I think if a woman or man wants to transform their body for the better, the first person they should go see is you.
Oh, man. I appreciate it.
Absolutely.
Hey,
Mikey Eckstein was telling me about you, man. He was telling me great things.
that's my guy.
Yeah, and we had to get you on here. So can we talk about yourself first, man? Where are you from?
Well, born in Southfield, raised in Ecorse, partially. You know what I'm saying? My grandparents spent a lot of time with them, Ecorse, Southwest Detroit area. DMV, moved to DMV, went to high school there. I always lifelong Detroiter though. So I came back when I came back from medical school after I went to FAMU for undergrad.
Wow.
Yeah. Always itched to come back to Detroit, man.
What were you
Like I
doing
never-
before school?
Before what school?
Before college?
Before college?
Yeah.
Getting into trouble.
Really?
Yeah.
You did not seem like a troublemaker.
Oh man, I was a big time troublemaker. Big time. Yeah. Had a few run-ins. I got all my troubles out early in life before I turned 18, so a lot of stuff we were able to make go away. Put it like that. Yeah.
Expunged.
Yeah. I don't even know if I would call it because it's juvenile stuff, you know what I'm saying?
Okay, yeah, for sure.
Mhm.
Yeah. So, when did you realize, like, okay, I'm getting into the medical field?
Well, when I went to college, I was originally a graphic arts major. I'm an artist. Like if you see my work, but you see my art, is one and the same. So, I had got into it in college because I said, you know what, man, I can't see myself doing this I can't see myself being an artist, a starving artist, as a profession. So essentially, I wanted to go into the medical field because it's pretty much guaranteed money. I mean, you can make a lifestyle out of it. No matter, I didn't know I was going to become a doctor even then, but I knew that I wanted a stable income, and I didn't want to. You never hear about starving doctors; they're out there, but not really though. You know what I mean? Yeah. So I still do art, even it's a hobby. So it's,
What kind of art do you do?
I do portraits. I do charcoal. I do graphite. Color pencil. I do we call it pastels. Got into oil painting. Matter of fact, one of my paintings is hanging in Detroit, at the DMC,
Really?
Detroit Receiving Basement. Yeah,
What's the painting of?
it's two of my professors that taught me a lot of what I know.
Very cool.
Yeah. They still working too, and they're in the 80s.
Wow.
Might be time for them to retire, but they were old back then, and when I started.
When you're getting into school, which university did you start with?
I went to FAMU, Florida A&M University.
Wow.
Yep. Hey, shout out to the HBCUs. Yep. So, Kwame went there. A lot of notable people went there. With some Melissa Butler went there. Lip Bar. And we got a few famous Common.
Very cool.
Yeah.
How long did it take before you got your doctorate?
So I did 5 years at FAMU. I partied a little bit. But I came back here to Detroit. Went to Wayne State, did 4 years med school. Then I did an 8-year residency after that.
I don't know what part of school it is when you decide like what particular parts you go into as far as what you do, what you specialize in. But when did you realize what you were going to specialize in?
All right, so when I went to med school, I was still doing art. I did all the art projects. I had another professor that passed away, and I did his portrait, and they put that up in the med school too. So I was doing all these art projects for Black History Month. You know what I'm saying? Ran the Black History Month program. Did all these art projects. Sold T-shirts during medical school, and basically all my classmates told me like you gotta do there's only two things you can do. You're either gonna do medical illustration, show draw and paint anatomy books, or you need to be a plastic surgeon. So that's what I did. So I found my mentor the second year of med school. If you don't know, med school is 4 years, and then during your third year, you kind of decide what you want to do. But I decided during my second year that I wanted to reach out to a particular mentor and get some plastic surgery up under my belt. And then shout out to Dr. Bala, he passed away too, man. He passed away right in front of me. But that was my
What happened?
dog.
Like,
He had a heart attack. Man.
Oh,
Yeah,
jeez.
he had a heart attack, right?
Was it easy to like when he was having a heart attack? Did you like notice what was happening?
Yeah, but we thought he had the flu at first, but then we put on the EKG, and then we knew he coded right there. It was a wrap, man. That blew me. That was halfway through my training at that point. Wow. So, but he taught me at least half of what I know. Yep. Shout out to Dr. Bala, man. If it wasn't no Dr. Bala, there is no Dr. Griffin. You know what I'm saying?
When you continue your journey from that point, you know, how many more years did you have before you graduated?
So when I met Dr. Bala, he showed me the ropes as a student. But then I finished medical school going into general surgery. So if you don't know, it kind of like picking your specialty, you go through what's called a match. So you find something you like, you apply to it, you go on these interviews. It's like the NFL draft. People, you know, you're scouting, except you have more control. So you're scouting these particular programs, universities or hospitals, and they're scouting you as well. So they kind of throw it all in the mix and you match together. It's kind of like matchmaking mixed with the NFL draft.
Very cool.
So I matched right here in Detroit, and I was happy about that because I wanted to stay. Anyway, my wife's from Florida. She was like, I'm trying to get up out of here. But we wound up staying. I did 5 years of general surgery, trauma down at Detroit Receiving, Harper Hospital, even Children's, and it was bad. It was an experience. Yeah. And you saw all the gunshots, all the stabbings, all the everything. Took care of all of them. Took care of a lot of people that I still see.
How long did you have to stay in that for?
So that was 5 years, and then I was like, I don't want this lifestyle. Getting caught in the middle of the night.
Which hospital was it?
It was Detroit Receiving mostly.
Wow.
Yeah, but also like I said, Harper.
What was the how consistent was it? Where you had to deal with like like something to that degree, where it's gunshots and stuff like that?
When you were the trauma rotations at Detroit Receiving was you're on call every third night. And call means you spending the night. You're pretty much not sleeping. You see everything. It's like being a firefighter in the sense that you never know what's gonna go down or when. You could have a quiet night, wasn't that usual at Detroit Receiving, but you got a night where you up all night treating gunshots, and you stuff you see on the news, you'll see it on the news, and then I'll see it in person and know all the details about it, and then you see some crazy stuff. You know what I'm saying?
What would you like?
Man, dude, I almost don't want to say it because he might be watching. Dude came in with the butcher knife stuck in his head.
Oh my God.
Hey, man, nothing like a woman scoring. So we had to pull that out and then make sure it wasn't in his brain and stitch it, clean it out.
Did he recover well? Did he like?
Oh yeah, he went home the same day, but we didn't go back to her. No, but then there was another. The craziest thing I saw was a guy that got shot point blank range. He was outside Club Blue on a Saturday night. I remember it clear as the day. I don't know what happened, but dude tried to off him. I mean, shot him point blank range. Mm-hmm. He had stipling all over his face and everything from that's how close the gun was. Okay. The bullet traveled next to his eye, under his brain, just millimeters to the left of his spinal cord. Went out the base of his skull. He came in. We didn't know what happened to him. He said he got shot. We didn't see a gunshot. Then we looked and we saw the gunshot at his eye and then the blowout in his back. He was sitting there talking to us just like we're talking.
Oh my God.
Yeah. And then, man, I hope he went to church the next day because he walked right up out of there the next day.
Wow.
Yeah. I'm like, man, that's your blessing, man.
I seen an interrogation video one time where they were interrogating this dude that had said he was shot, and they didn't, like, the officers weren't believing him. And he's like, I was shot, like, in my eye, and it just looked like he had a bruise or something. It didn't look like a gunshot one. Man. And then his brain actually started swelling up during the interview, and he passed out.
Yeah, you see it.
It's hard to know bullet wounds sometimes, I'm assuming.
Yeah. I mean, we have people that get shot. Like 50 Cent, he's been shot 9 times, and some of them will be exit wounds, entry wounds. You got to sort all that out.
What's like the statistically, like if you're getting shot, like obviously it's hard to say it percentage wise, but what's the chances of survival if you get shot in like the most relative areas, like your chest and your head?
Honestly, your chances of surviving getting shot is higher than you think. Yeah. You hear about how many murders in Detroit a year? 300, between 300 and 400. About 1,500 people get shot, and so that you take out that 300, the vast majority of people survive. Yeah. It's either bad shots. You get hit center mass, the middle of your chest. You if you don't have immediate intervention, you probably are goner. You get hit. You can get shot in the head and survive, like we just talked about my man. You can even get shot in the brain and survive. But if it crosses the midline, you're pretty much out of there. That's what we call the corpus callosum. So
what's that you just said?
The corpus callosum will separate the right brain and the left brain. Oh. You cross that midline, or you get shot in the brainstem, it's over with. Yeah.
Wow, man.
So like I said, I saw a lot, but did a lot.
But you decided it wasn't for you.
No, man. That type of lifestyle, man.
Was the pay decent? Like, did they?
No, I was a resident, so we don't get paid. We didn't get paid jack. I mean, you get paid what? As a resident, I don't know how much they get paid now, but back in the mid 2000s when I was there, I had paid what, $45,000 a year.
Oh, damn.
Starting out.
Let's get real. You don't know what the hell you're doing as an artist. You have all the talent, a little clout, but no motion. That's because you don't know what the hell you're doing. I know it's harsh, but it's true. That's why we developed the Artist X strategy. It includes one-on-one sessions with hip-hop and entertainment moguls that will walk you through this hurricane we call the entertainment industry. You can receive coaching, music and social media analysis, and networking opportunities. Message kid.l.video on Instagram to learn more. Guys, stop traveling in the wrong direction. With an in-depth analysis, one turn can literally turn your career around.
I never made I only made more than that because I hustled on the side. I moonlit and did some other things. Yeah.
Cool.
Yeah.
So 5 years, you moved. What was the next move after that for you?
So then I got into the pro. So Dr. Bala, circled back to him. He pretty much got me in the program. I mean, it was solid being a Detroit guy. They wanted to keep me. So they kept me. So I did another 3 years as a fellowship on top of the 5 years trauma in plastic surgery. So then, I'm not just doing cosmetic stuff, but I'm also doing burns, facial fractures, a lot of hand stuff, a lot of wounds, like, bed sore type stuff, a lot of different stuff, the full breadth of plastic surgery. But that's where I learned. You really learn that way. Learn the anatomy, learn how to keep skin alive, learn how to make stuff pretty.
Wow.
Yeah, in a way that no other doctor can.
Well, you having an artistic mind, how did that help you into understanding transforming the body?
So it's funny because I think 100% me being an artist helps me as a plastic surgeon because it helps with the understanding. Now, dealing with human tissue is different than a canvas, but for the most part, I don't do a lot of measuring. Like you see, you don't have to be an artist to be a good plastic surgeon. But the ones that are not artists, they got to do a lot of measuring. They break out, break out the measuring tape a lot. I don't have to do that so much. And I don't always get it right, but for me, I do a lot of eyeballing and just look at something and just say, this is what we got to do. I draw it up, mark the patient up, and then make it happen. So it helps.
What was the first year of having your own practice? Like, what year was it?
I went in my own practice in 2021.
And that was officially for body transformation for plastic surgery.
For the most part, yeah. I was probably at that point about 80% cosmetic and maybe 20% reconstructive. But now I'm like 90%. I hardly do any reconstructive now. But
what's reconstructive again?
Like, reconstructive is where, something's actually wrong with you. You got into a car accident, you got a scar, or you got burned or something like that, and you're reconstructive is restoring the normality.
Normally, like your insurance would cover that normally?
The insurance would cover that, and I'm getting out of the insurance business.
Insurance,
Not completely, but
insurance doesn't cover cosmetics, right? Like or anything like that.
Insurance will cover. So it'll cover a breast reduction if you meet criteria.
What's the criteria?
Back pain, your breasts. You got to be able to guarantee that you can remove a certain amount of tissue. You got to have the shoulder strap grooving from the bra. You got to have rashes up under your breast. And then certain insurers like the Aetnas and the Medicaids, they don't want to pay, and they make it real hard to get approved. So they move the goalposts.
Would it have to be like a double Z or something like that?
Man, they got it basically.
Really?
And then I get paid scraps for that. But sometimes I do it just on the humble, help people. I got into it for helping people. You know what I'm saying? So,
that's a beautiful thing, man.
Yeah.
Obviously it's huge now, right? Plastic surgery is humongous.
Yeah.
And it's helping people feel confident about themselves. It's helping transform. One of my cousins, he had some jaw surgery when he was younger.
Mm-hmm.
He went from looking like Pee Wee Herman to Leonardo DiCaprio. And I was happy for him. Yeah. It was great stuff. But when your first year of practice, what was the initial clientele? Who were you dealing with the most in the beginning?
So when I first started, I worked for the hospital for 6 years. I won't say which hospital, but I was there today. but I was an employee then. So I got, I had to build my practice. But I started off doing a lot of, and I still do to this day, post-bariatric weight loss patients, people that have lost 100, massive weight loss, hanging skin. I do quite a bit of that. So that was my main clientele. My clientele overall is older, more educated, you know what I'm saying, more sophisticated. And, like I said, they're a little bit more seasoned. So
is it usually a husband's pain, or like how does it normally go down?
Yeah. And I'm gonna tell you this: it ain't when people think that they're getting all this plastic surgery for a man. The man almost always says, I probably say about 75 to 80% of the time, I love her the way she is. She don't have to change nothing, but this is what she wants to do, and I'm a supporter.
Yeah.
The husbands, yeah.
And then they're happy afterwards when they see the results, right?
They're happy. Yeah. They're happy.
I couldn't imagine if somehow my wife gained like 300 or 400 pounds and just having to deal with it, son. Like, I wouldn't be able to just be cool.
Man, you're not, as a husband, you shouldn't let her get to that point.
Right, facts. Yeah. But if they just happen to so do it, it's like, okay, women are all about like, oh, you should love me for me. But it's all like, all right, but men have natural attract. Like, we have to be attracted to the person we're with.
Men are visual. Men are definitely visual.
It's like, why are you taking that away from me if I'm married?
Yeah, I mean, but you do get to a point where it's like this is the woman you loved her when, like I said, bariatric patients or weight loss patients are probably my number one clientele. So these husbands have been through all of it. They've seen them on wedding day when they were thin, after the babies when they gained some weight, they gained some weight even more. Then they lost the weight by working out, surgery, combination or all of it. But they've been through all of it. So if they stayed through all of that, you know what I'm saying, they're solid.
Let's cut down to brass tacks, man. What's going on with these BBWs?
BBWs?
Or sorry, the BBLs.
BBLs?
Yeah.
Okay, BBWs, BBLs.
What's going on? What's going on with these BBLs?
Which one? The good ones or the bad ones?
Both of them, man. What's happening?
I mean, there's some women going overboard, and listen, women want to blame the men for that too, but they're in the comments talking about, well, if you weren't looking at the Instagram models with the big blown up BBLs, then we wouldn't be doing it. But y'all are the ones doing it. I'll be honest with you. Most BBLs are done naturally because more people have BBLs out here than you think. They ain't just entertainers. They're your politicians. They're CEOs. They're getting them too. The teachers, principals.
What's happening?
They're not all BBLs are created equally. There are ones that go, you don't have to put all the fat back in. You can just do a little subtle thing. And my philosophy is make it look natural, transform the hips, and then use it more for reshaping than adding volume in most cases.
Do you ever see a time where somebody doesn't need it, but they think they need it?
That all the time.
Yeah.
And then some people have booty, but they don't have hips, and they're like, just add a little to my hip. But yeah, I get that every once in a while. Like I talk them out of it.
Really?
Yeah, I mean, I have integrity, man. I'm not just about to take anybody's money just because you're dangling it in front of me. If you need, like, I'm gonna tell you the honest truth. Do you need this? No. I talk people. I turn people away sometimes. A lot of times.
How do you examine it? Do you just like tell them like with clothes on? Do you tell them like, do you give me a 360, or do you like tell them like, all right, let's strip down and like see what we got going on? Like, how do you
that's
do
the consultation. You're pretty much down to your underwear in the consultation.
Do men do it too? BBLs?
Yeah.
Wow.
I don't look. I've done one BBL on a man, and it wasn't. I didn't make it a woman's BBL. I added a little at the top, and that was that.
Why did he want it? Like, what was his deal?
So I mean, he was working out, but he had like a flat butt, so he wanted to look like he had been squatting and had muscle at the top of his butt, and that's what I'm willing to do. I'm not willing to it's just my philosophy. I'll enhance men to be men and women to be women, and that's nothing against any particular community. That's just my philosophy.
Why are we seeing BBLs that deflate?
Could be. I think most of the time it's probably the Ozempic thing right now. I think people have gone out getting BBLs and then realizing that they don't look. They kind of let themselves go after they got the BBL, and so they're gonna get on the Ozempic trip or just lose it naturally, but then you lose the volume as well in the butt.
Ozempic took over everything, man. It looks like Hollywood's like really utilizing it, right?
Yeah, it's a big deal.
I think Lizzo. I'm not saying that Lizzo's using Ozempic. I'm not saying that, but like
she might be, but there's nothing wrong with that.
Yeah. What do you know about it? Like, are you like obviously?
Yeah, we have the compound in our. We sell the compound in our office. So
what's the deal with it? Like how powerful is it, and also how safe is it?
It's very safe. It works. So what we do is we start you off at the lowest dose, see how that works for a month, and if you're losing at a steady state, we quote patients 5 to 10 pounds a month or so that they can expect to lose. Wow. If they're not losing much, or they if they're staying if they're plateaued or they're staying flatline, then we ramp them up to the next dose.
5 to 10 pounds without working out?
Yeah, but you got to work out. I encourage the fitness part of it, because if you get off of it, and you're just going to bounce right back to where you were.
Is there a quick breakdown you can do of Ozempic and like how it actually works in your system?
Yeah, so it's a GLP-1 agonist. Essentially, the long and short of it is it makes you feel full faster, because it works with diabetics by modulating kind of the insulin in your system, and slows your gut down. So some of the side effects you can get is constipation. The worst thing I've seen, probably not even any of my patients, pancreatitis. So the long and short of it is it slows your digestion down to where you feel full faster, and you don't eat as much. And then you drop the weight.
Incredible. When we're talking about what you do, what are you most known for as far as transformations are concerned? Is there something where people say he specializes in the specific area of the body?
I do mostly tummy tucks or some variation of it, but I think I do so much post-weight loss surgery that I'm known for. I mean, I'm known for a few things. I'm known for the body lifts combined with the BBLs. I think what I'm known for here in Detroit is the tummy tuck combined with the BBL, because a lot of people go out of town. They won't do it in other states. Largely in part, let's just put it out there, Miami is highly regulated because of some of the things that they've been doing, and kind of the assembly line surgery that they do. So they actually have legislation against performing certain surgery with certain parameters.
What's going on in Miami?
Well, you gonna have a lot of your listeners went to Miami. So the Miami, no matter who you went to, I bet you love your doctor, but and I know the price is cheaper, but it's cheaper for a reason. There's only one way you can make a commodity cheaper, right? Produce more of it, right? How do you produce more of something in the same finite amount of time? You do more of it at the same time. In other words, okay, yeah, you're on the table, but there's somebody else on the table at the same time in another room.
Oh my God. So this doctor's going from door to door, just like in one day, just taking care of what he has to take care of.
They're gonna hate me for this one, but it's the truth, and people know that. It's no secret. I mean, then they push you right out the back door, and on your BBL pillow, and call it a day, and you go to your recovery house, and it's a big market, and you know if you're willing to save a few bucks to go out of town and deal with the potential consequences, because I got complications. Yeah. You know, it just comes with the territory. You do enough surgery, you're gonna have complications. But would you rather have that out, you know, fly back to wherever you're coming from and be stuck? You have to fly back.
And another thing that's crazy is overseas too, where it's just like a quarter of a fraction of the price, but who knows what's going on over there?
Oh, I know.
People are dying when they go out to like Mexico and stuff like that.
Dominican Republic in particular.
Yeah, they're literally like straight up like dying on the table and stuff.
They have it's really unregulated there, so they don't have any, like for instance, in Michigan we have a 5-liter limit of liposuction. We can only take off 5 liters of liposuction in Michigan. In Florida it's actually 4 liters. It got so bad in Florida that they had to really tighten up in order to curbside some of the things that were going on. And in Dominican Republic, they'll do 13 liters. And
oh my God!
And the problem with that is, okay, now you have fluid shifts. You have blood in your vessels, your veins. Now they're shifting. Once you take off that fat that much, you're shifting it out into the tissue from your vessels. And that makes it harder for your heart to work.
I'm scared.
Yeah, so you got to be well hydrated, and most people do fine, but you know.
Now we're talking about your expertise, man. I've seen your work. I've seen the transformations happen, the before and afters, and it's phenomenal, right? Like you can see just grade A transformations from people.
Appreciate that.
When we're talking about how you marketed yourself, social media is obviously relevant. Word of mouth is obviously relevant.
Yeah.
But what do you feel like was your powerhouse in getting people to know about what you were doing?
Oh, word of mouth for sure. You know, you do one, dog. There's like 3 or 4 patients that really blew me up, and there's really like 2 in particular. And I don't want to put them out there, but they know who they are. I love y'all. You get them right, and then you know they're telling their clients, and they're showing their work, and it's just word of mouth after that. But you know, my social media game it's okay.
Oh, you're great on social media because you have the entertainment value, you're charming, you got everything going on where people trust you. You know what I mean?
Yeah. So I'm trying to show my personality a little bit. People think I'm uptight. I mean, I ain't uptight, man. Come on, man. Y'all know me. If you've hung with me for real, instead of just seeing me on walk by or whatever. You know
well, there's not many celebrity doctors, you know.
Yeah, I don't consider myself a celebrity, but
well, I mean,
maybe Detroit famous.
And yeah, you know what I'm saying, Detroit.
Yeah. It's a small market. I'm like a big fish in a small pond. Like my guy Triggs in Miami, he's a big deal.
Do you think it's going to be a trending wave where doctors are going to start marketing themselves more like the way you are and branding themselves, or do you think like it's still going to be just these doctors just don't know how to get on the apps and work it out?
No. The social media game. Dr. Miami, he was the benchmark for social media marketing, and everybody kind of just fell in line. And they're on TikTok. I'm not even on TikTok, man. It's too much social media. I got to focus on my patients and my craft at a certain point. So it's like some of these doctors are doing too much. And it's taken away from their patient care.
Facts. I was talking about that the other day. I was like, everybody's live streaming their work, and it's like, how are you focused on your work when you're live streaming? Like, there's police officers that live stream their shifts. I'm like, bro, how are you watching what's happening when you're live streaming your shift? Yeah, I can't imagine what some doctors might be doing out here these days.
Yeah, I mean, it's okay. I think it's okay to live stream if everything's going just like most of the time when you're flying, everything is smooth sailing, no turbulence. Yeah. So that's how it is most of the time. But things can and will happen. How
many celebrities do you work on yearly?
Let me tell you about the celebrity class. So celebrities are interesting because the juice just ain't worth the squeeze sometimes. And this is why the reason why I say that is because, I mean, think think about it. Okay, name a celebrity that you pretty sure had plastic surgery.
Pauly Shore.
Of all people,
I don't know why I went there.
All right, let's stick with Pauly. Who's his plastic surgeon?
Some guy in L.A.
What, you don't know his name?
No.
So he never really amped him up like that. He never really put him out there. Like, and they tend to want discounts. They tend to no show or come late, and they tend to be divas. You know what I'm saying? So most of my clientele are average, everyday people, man, teachers.
I can imagine that, right? A celebrity, they feel like there's some type of status where, like, you know, they act like they can help you, but they can't because they're not going to promote the fact that they got plastic surgery, right?
Man, they're not.
Yeah.
That's what I'm saying. And so you don't really get that. And then they want you to do the surgery for free. And they won't go to the Gucci store and ask for a discount.
Wait, they don't ask for it for free.
No. Yeah, they will.
No.
Yeah, man.
So what though? What's the convert? Like, how do you? What's the
because
transaction?
they're like, I'm famous. You should feel privileged to have the ability to put your knife on me.
That's insane. But have you worked with celebrities though?
Yeah, they'll
without naming them, obviously. Like,
I won't name them, but look, man, my practice was built on average, everyday, hardworking people. On
a comparison level of how famous these people were, like, who can you compare them to, like, status wise? Without saying, like, you know, just give me one. Like, give me like
compare them to status wise. I would say, well, I don't know. Name one of these talk show hosts.
Jimmy Kimmel.
Like,
Jimmy
I don't
Fallon?
know, Tasha K or somebody like that. That level.
Okay, cool. That's cool still.
Yeah.
What about NBA players?
No. But I've talked to NBA players about other things. And they've sent me people. Like I've talked to Jalen. I've talked to Lindsey Hunter. You know what I'm saying?
Very cool.
A few of the Pistons. Jimmy, my frat brother. So Jimmy King. Yeah.
Wow.
Yeah.
Did you hoop with him or did you?
No. They're older than me.
He was on a different level.
Yeah.
Yeah, man. You know, like you said, it's the everyday. It can be an everyday person, right? Just normal person. That's the most of the clientele.
That's most. Yeah.
Budget.
They're very grateful, and then they're the best patients.
What's budget wise? Like how much are people looking for? Like you said, your specialty tummy tuck with a BBL combo. Like, what's like kind of like a price range-ish, or like what type of income does somebody have to be making to make these transformations?
I don't know where the people getting the money from, but they're coming up with it, and it's not going straight in my pocket because I'll charge I don't know what we could charge, like $6-7 for the combination, but then you got to pay for the anesthesia and facility fee on top of that, and then it sounds like I'm expensive because you lump all that together.
Yes.
And of course, it's more than Miami. So yeah, why wouldn't you hop on a flight if you got a particular budget? But we finance it and we do care credit.
Can you talk about the safety precautions you take to make sure that everything goes smoothly during procedures?
Absolutely. Look, so I get clearances on everybody. I get pre-op clearances from their PCP. It's not a deal breaker if you have, slight medical conditions, high blood pressure, diabetes even, but we gotta clear it. We gotta medicate them preoperatively. Make sure you're right. The right BMI is a big one too. That's the thing. My BMI limit is higher than a lot of surgeons, largely in part because African American women are the largest demographic, and we know that BMI is deceptive, and we know how.
What's BMI?
Body mass index.
Oh, okay.
And so, like you had Dank on here. Her BMI is off the chart, but at a certain point, she's gonna drop to it sounds like she's on her health kick, like Lizzo is. So the BMI might fall still high, but it'll be in range if you're healthy. So I'll
Is Dank Tomas in range?
No, not right now.
So she can't get surgery right now?
No, absolutely not.
So how much would she have to lose?
I
don't know.
I don't know where it's at.
Man, I don't even think she cares these days because I think I think she's all about I don't think she's mad about people talking about her weight because
she can't be. She's showing her backside on.
Bro, sometimes when I open up Instagram, she's my friend, but god damn, sometimes I'm just like, god damn it. Like,
yeah, I mean, that's confidence, man. Look,
come
man.
on, man. Like,
you got all the confidence in the world. Look, you know how long it took me to become a confident surgeon, even when I was clearly competent. It's been a while.
For sure.
So back to your question. So BMI, bad things can happen. Your BMI is too high. Blood clots. You got sleep apnea, respiratory things. A lot of things can happen. And then if you know. I work in the hospitals, you know, so I work in surgery centers. But if you have medical conditions, if you're a little older, then I'll do it in the hospital where, say, if you have one-on-one nursing care, monitoring for 24 hours.
Nursing care?
Yeah. I mean,
for how, like,
nurses.
I'm sorry, for like, how old are we talking about?
Well, I mean, you know, I think we make it mandatory. So if you're 60, we do it in the hospital. Nursing care, just like you have a nurse attending to you while you're in your room.
Oh, yeah,
not that you're in the nursing home.
I was about to say, they're doing BBLs in nursing homes?
No,
That's crazy.
But,
But I see what you're saying. You have nursing that specializes in making sure that the recovery happens properly and that they're taken care of.
Yeah.
So you guys are just fully about safety and health. Like, it has to be.
Got to be, man.
Yeah.
And it's not a perfect craft. You know, this medicine ain't perfect. It happens.
What's the biggest concern people have when they do come to see you that haven't had any surgery or anything done before?
I think their biggest concern is, are they going to get the results that they want? And you can't always guarantee that. They have to have realistic expectations. Some people will, you know, their wish picture will look nothing like them. You know, they'll show you the picture of Beyonce, and you know, the bony structure isn't even that. So, or you know, everybody has a different fat. Everybody has different skin types. Everybody the weight loss patients lose all their elasticity. They're a different category of how we even approach surgery.
Wow.
It's even down to the techniques. You know what I'm saying? So
when it comes down to people wanting to look like celebrities or wanting to look like famous people or whatever, is it common, or is it more so just like, can you push me in that direction?
I push people to be their best version of themselves.
Yeah.
You know, I mean, man, God put you on this earth because you are a unique individual, and you should be happy with that. So there's nothing wrong with plastic surgery. Of course, I'm a plastic surgeon, but I'm going to enhance what you already have and not turn you into a different person.
Yeah, because you see people on the internet that, like, there was a guy who wanted to look like the Ken doll, right?
Oh, man, these people crazy.
And some
man.
people a girl wanted to look like Cinderella, all that type of stuff. And they do it too.
I know, and I blame the plastic surgeon in a lot of ways because, you know, they're the ones taking the work. I'm like, you know, it's
You
I
have
don't know.
morals
I have different philosophy. I have ethics. You know, these guys, some of the guys out here doing some wild stuff.
Yeah, you're gonna sleep better at night when you don't have that karma hanging over your head, knowing that you just ruined somebody's entire life for some money. Like, they just, at that moment, they might have felt like, man, I just don't look good, or I don't look enough, and it's like they just don't see it for whatever reason. They might be demoralized for whatever reason, but
yeah, absolutely.
as your job, it's like you're a coach too to them, kind of.
I am more so than people realize. I think people just think that, oh, I'm, you know, you just sign up and I give people what they want. No, I really, if you got to lose 30 pounds, look, I work with trainers to, you know, to get my patients to where they need to be. I have like a network of about 10 or so trainers that are my friends, that they're working out with them to come to see me get their work done. Then I send them right back to maintain those results.
Brilliant.
Yeah. Yeah.
So you have like an ecosystem of people working with you,
absolutely.
not just the surgery department.
And that's the beautiful thing about Detroit. Everybody, you know what I'm saying, it's a symbiotic relationship.
Let's just say, when we talk about the amount of weight that you don't think is necessary for plastic surgery, somebody wants to lose weight, what's like your limit where it's like, no, you don't weigh enough for me to do work on you. You can just go to the gym.
Enough?
You don't weigh enough, and you could just go to the gym and work that out. It's better to do that than
you mean, yeah. Well, yeah, so, yeah, I get that. But, you know, there's little small tweaks we can do. Like, I do a little skin tightening. I have one of my trainers, his wife is my patient, and everybody say, her picture's on my Instagram, and people are like, you didn't need to do anything. But to her, it's like, okay, but I still have this. I'm working out every day. I still got this little, so there's little, like, even things that we can do in the office.
But is there a weight that's like, no, just go to the gym? Like, if somebody comes in like at 190, are you like, okay, we'll do it for you, or are you more like you can work that off?
No, because most of the time they've already tried to do the work, and it just hasn't worked out for them. Because really, in all reality, there's really only so much you can do a lot of times. You have babies, them babies they've separated your muscles, they've caused a flap. If you got a C-section, now that flap it's really not going anywhere.
Right.
So that in that instance, a tummy tuck is your only. So it doesn't matter what weight they are. They could be slim everywhere else, but they still got that bulging out because of what those babies did. That's why we call it the mommy makeover.
Can you break that down a little bit more? Like,
what a mommy makeover is? A mommy makeover is anything you want it to be based on the after effects that your children have caused. Whether it be your breasts, they're sagging, you breastfed. Now you're not breastfeeding, your breasts are deflated. We do a breast lift in combination with a tummy tuck, or a lot of women say their butt started sagging after the. So we do a BBL after that, and that's part of the mommy makeover. So I let the patient tailor what they want, and guide them in the right direction in terms of getting them.
You know that flap at the very end that everybody has after C-sections, or that loose fat. So, is the only way to get rid of that through surgery?
Unless you're very blessed. I mean, I had one patient, and she's snapped back so tough that she didn't need. Like, she had a baby, and her tummy was flat as hell. Its flat was like washboard within a few months.
Yeah.
I mean, but she didn't have no booty, so we, did a BBL. But
what's absolutely something that you have to get surgery for that working out will not fix?
Definitely what I just talked about.
Yeah.
When you got that muscle separation, working out could actually make it worse because you're increasing your intra-abdominal pressure and pushing that out even more, trying to work out and separating your muscles even more.
Is there any long-term issues when you do those types of surgeries, or is it actually like you're healing the body to some degree?
There can be issues. The issues that usually come around, a lot of people feel this tightness. I had a couple patients, for whatever reason, they said it just feels like a tight band around, and it's just like muscle contracting. And I don't know what I did differently, or if I did anything differently at all.
Is it permanent, or were they able to?
I think you give them muscle relaxer, but that's just one of those mysteries of medicine where you thought you did everything, and it's the patient's complaining, and you can't really feel what they're feeling, and unless you can see something in the world of medicine, it's a tough thing to deal with. So a lot of times we just send them to. I got patients that I got friends that have pain clinics, and can treat them that way, with like injections or, But I start off with like a muscle relaxer and see what Sometimes you got to see what works.
Yeah.
Sometimes it's nerve pain, and you gotta give them like a gabapentin, which is a nerve agent.
Wow.
To combat that. Yeah.
Wow. So take care of your bodies from early age is probably the best way to start all this, right?
Definitely take care of your body, man. Your body's your temple. You only got one of them. Yeah. You know what I mean? And that goes for me too. I mean, I gotta live my creed.
You hit the gym often?
Almost every day. But I don't always eat right though. My wife is from the South, man. So she makes sure I'm eating good.
Yeah. They're down south the fish is better too, right? You got more of that.
I mean, a lot of stuff is, but it's not all healthy for you.
What's your guilty pleasure?
Oh man, it's got to be fried chicken. But it's the amount of cholesterol in my. And that's the thing. That was the only thing that was off from my last doctor's visit was my cholesterol. So the amount of cholesterol, is in fried foods in general, yeah, it can get you. So I kind of transition to baked chicken, fish, trying to eat healthier.
Have you ever taken somebody from like a 6 to a 10?
You tell me. You said you see. Yeah, I mean, you see
it's hard to see. They don't show their faces all the time.
Yeah, you're right. Look, man, I say so. I think they were just a lot of women are just missing that one thing to give them confidence. And I got a beef with some of the ladies because they go out here and start acting a real fool, start acting all high and mighty now that they got this new body. Listen, Dr. Griffin does not approve of that. Be kind, be yourself, be the person you were beforehand, and don't go out flaunting stuff. But 6 to a 10, yeah, and you know what? That can cause problems in a relationship too.
Oh, facts.
You know what I'm saying?
Yeah. Damn, man. Imagine your girl gets a transformation and just leaves you. Wow, son.
It doesn't happen very often though.
But it happens.
Yeah, it happens, but what happens more is just the man is insecure about her wearing the form-fitting dresses more so and wanting to show off and wanting to go out more and stuff like that. So it's like the man, it's a man a lot of the times.
Damn.
It could be the woman, but plastic surgery won't cure your relationship ills.
Before we close out, man, let's do something fun. Let's talk about some celebrity transformations that you've seen in the public has been able to see. And what's the worst plastic surgery you've seen done to celebrities?
Oh man, where do we start? Oh man, Elon Musk. Let's start at the top.
What did Elon Musk do?
Elon Musk, I don't know, man. I think he had the hair transplant, the cheek lift, the cheek injections. He had the BBL drizzy abs for sure.
God.
This is stuff I've looked, it comes to me. A lot of stuff comes to me.
Wow.
A lot of people have gone and done just asinine things to themselves. Like, what was the cat lady of, I forgot. She injected fish grease or something like that into her face.
Oh, man.
Yeah. And just, but what's happening now is a lot of women, like you take Black China never really looked bad, but what she's doing now is getting her fillers taken out, getting a more conservative look to her. And that's the wave right now. You know what I'm saying?
How do you feel about what happened to Michael Jackson's?
Yeah, Michael Jackson was it's body dysmorphia. That's what it is. So body dysmorphia is pretty prevalent in the plastic surgery community. It's like 3% of the population in general, but it's like 15 to 20% of all plastic surgery patients. So us as plastic surgeons, we got to weed that out and kind of rein that in. And you can't be one of those guys taking the money and making them look like Ken dolls, right?
Yeah.
So Michael Jackson, he took it overboard. I mean, it just started from his childhood, that childhood trauma that can carry itself with you, and then the vitiligo on top of that. So there's no real good treatment for vitiligo today. UV therapy, there's certain medications that are getting better, but that affected him.
What happened to his nose? Like, what was that all about?
So basically, he got a nose job, got it done again, and then he got it done. So basically, what happens is you go back into that same scar tissue over and over again. You're depleting. Number one is it's just the scar ball in there. The scar burden is just so overwhelming. It's hard to really recontour a nose like that. And noses are tough. I don't even do noses. Yeah. You got to be like super specialized for noses. And then to go in again and again and again, you run out of cartilage. Like the cartilage was depleted. So they were taking cartilage from his ribs, cartilage. You start taking cartilage from the ear, but then you go to the ribs, and eventually, I mean, it's only so much you could do to rebuild a nose.
What do you give that score out of 10 as far as what they did for him?
I think I put him in line with like Little Kim, because Little Kim at a certain point, she had some stuff done here and there, and she still looked pretty good, right? Maybe up until in like the late 90s, early 2000s, and then she just took it overboard with the fillers, and then the nose job, and then the implants, and you just take it too far. So I give him a D minus. At a certain point, when you're the onus is on you to say, look, this is what's normal. You look good. You should stop. And gotta rein it. But if one plastic surgeon tells them no, you dangle money in another plastic surgeon's face, they may take it. And that's just it's a cutthroat industry.
Well, when I see Elon Musk, I don't see like a guy that doesn't look good. But you're saying, like, what are you saying about his plastic surgery that like throws you off?
It doesn't look natural.
It doesn't.
He doesn't look natural.
Yeah.
I don't know. I mean,
Should I pull a picture up of him?
Yeah,
So you
pull
can
it up,
look,
pull it
yeah,
up.
'cause, yeah.
You know, Kardashians, I don't think they look bad. They just don't look like themselves. You know what I'm saying?
Well, the Kardashians are like clearly on that level where they're constantly getting plastic surgery.
Yeah.
Is this? I don't know if this is the new version of him. Is this the new version of him, or is this?
Well, look at the old version.
Oh my God! I didn't even really look at it.
No.
Yeah,
It's right in front of
you
your
can tell.
face.
The first one looks like the white version of Juntao from Rush Hour, and then the second version just looks like a decent looking guy. What about Jeff Bezos? Do you think he got plastic surgery? Because he's looking sharp, man.
He might have, but see, if he's looking sharp, it's a right way to do it. It's a right and wrong way. Are you enhancing what you already have subtly?
Damn.
The best plastic surgery is the type of surgery that you cannot tell happened in the first place.
Is there anybody else that you've seen in the celebrity lifestyle that you were like, all right, that's a really bad job? I'll look up while you say it. Let me
Get me in trouble.
No, you're not, man.
I'm
These are
gonna
people.
stick to the real crazy looking people that really do a lot to the face.
I just looked up Little Kim. That is dramatic.
Yeah, it's kind of sad. I mean, again, that comes from childhood trauma. That comes from. I thought she was beautiful. You know, people were calling her ugly. Pac called her ugly, and that kind of drove some of Biggie. You know what I'm saying? So you just got to know when to stop.
You think Trump's had anything done?
Spray tan and the hair. No, not really. He doesn't.
Like,
not
what the
really.
hell? Like Mickey Rourke.
But Mickey Rourke was a boxer, so he had some of his stuff was reconstructive. So he broke his nose a few times, and I don't think he intended it to look like that, but I think they did the best they could in reconstructing it. I think he had like a what do we call it? Open roof deformity of his nose where it actually imploded, and they had to rebuild it. So I give him a pass because he boxed.
Okay, yeah, for sure. Damn. What do you think the best plastic surgery done in Hollywood has been?
See, that's gonna get me in trouble too, because
Why?
if it's the best plastic, because they'll deny that it even happened.
Oh,
like I think Beyonce had nose contouring. Oh, Kelly Rowland, she clearly had, some work done on her nose. I think she was beautiful before, and I think it was done conservatively, and she still maintained her solid looks.
If you had to look at me and be like, yo, you need to fix these things.
Them teeth, man. Get them teeth together.
Oh, my God.
Just don't get the chiclet boys, That's what people get the chiclet teeth today, too.
You can't help me with teeth, though, right? Because you don't do any teeth
I
work.
don't do teeth, man.
Man.
But that's the easy one. Yeah.
Damn, son. Man,
I'm honest, man. I'm brutally honest.
I
If you come to
appreciate
see me, you're going to get the truth.
No, man, I appreciate the honesty. I appreciate everything you've explained to us. I got to get you on for a part 2, man. I feel like we scratched the surface, but there's a lot more we can chime in on.
We can go on forever.
For sure. Can you tell everybody about the business one more time and how they can get in contact with you?
Yeah, man. I'm West Bloomfield for now until I build my own surgery center.
Sedity.
Yep. And so I'm at 6900 Orchard Lake, Suite 105. 248-557-7788.
Social media?
IG is probably the most popping thing. So Griffin_plastic_surgery. Yeah, they shadow banned me. I think I showed too many nipples or something like that. So so you got to type out the whole thing to find me. But
man, people getting freaky to your
you
page.
tag me in this interview, and there people know where to find me.
Yeah. I hope people aren't getting freaky to your footage, man. I hope not. I hope it's not getting that bad these days.
Look, man, some patients are some bangers, dog. My frat brother's like, is she single?
Yeah.
Come on, now.
I appreciate you being a part of this, man. We're a Parallel Sound Studio, Highlight Visual Shootings Productions. We're out. Peace. Fire, man.
This episode was brought to you by Kid L Productions. For music video, photography, event video, video production, consulting, and more. Book with Kid L today.